Hello and welcome to episode 7 of the COVID Longhaulers Podcast. We're a community of COVID longhaulers who have been brought together by this illness and wanted to create a resource for other long haulers. We share the stories of folks who have been through it, who are going through it, and how they're surviving it. My name is Emerson, and I'm here today with Jessie. Hi, Jessie.
Hello.
And we're here to talk about a really important topic.
That's right. Today is March 15th, which means that it's Long COVID Awareness Day. So we thought this would be a great opportunity to discuss the pressing topics within the long COVID community.
Yeah, and to get a better sense of what people in our community are facing, we put together a survey covering key issues. So things like access to healthcare, how long COVID affects daily life, and the role of advocacy.
And the response was incredible. We had 106 people fill out the survey. So today we're going to dive into what we learned and discuss some of the most important issues for long haulers. We will also be talking to some special guests who will share their personal experiences.
Yeah, so today we will be talking about diagnosis and medical care, long COVID's impact on work and school, as well as its impact on social life. Then we will cover things like support, resources, and communities for long haulers. And finally, advocacy, awareness, and calls to action.
We've got a lot to talk about, so let's jump right in. First, I think we should briefly discuss what long COVID is, what the common symptoms are, and how many people are affected by it before we get into the difficulties of accessing proper long COVID care. So, what is long COVID?
So the World Health Organization defines it as the continuation or development of new symptoms 3 months after the initial SARS-CoV-2 infection, so COVID, with these symptoms lasting for at least 2 months with no other explanation. This includes both symptoms that were newly developed post-infection, so things like a new POTS diagnosis or ME/CFS, but also the worsening of pre-existing conditions like asthma, tinnitus, or diabetes. However, research published by Dr. Ziad Al-Ali has found that people can develop long COVID up to 2 years after their acute COVID infection. So it doesn't have to happen immediately after your acute infection resolves.
So, what kind of symptoms are common with long COVID?
Because long COVID is a multi-systemic condition, it has over 200 identified symptoms that affect various organ systems. But the most common symptoms include fatigue, which is actually considered to be one of the most debilitating symptoms, and some choose to even call it pathological fatigue. There's also brain fog, cognitive impairment, memory issues, shortness of breath, and chronic cough, loss or alteration of taste and smell, sleep disturbances, new or worsening allergies and food sensitivities. This also counts for medications, so people become sensitive to medications. Also, depression, anxiety, and other mental health disorders, reproductive system dysfunction, heart palpitations and chest pain, and gastrointestinal issues like diarrhea or constipation. So there's a whole variety of symptoms, and these symptoms vary among individuals, so not everyone with long COVID will have the exact same symptoms.
Yes, and your symptoms can also evolve through time. So, some people call this system roaming. I used to call it a game of whack-a-mole.
I love
You
that.
spend, yeah, like whack-a-mole is my health condition. You spend time trying to recover from one symptom, but another pops up in its place. And then symptoms can change, they can improve or get worse, and completely different ones can pop up too. And you feel like you're going nuts. This can be caused by repeat COVID or other viral infections, ongoing immune dysregulation, or through PEM crashes, post-exertional malaise crashes, that can temporarily or permanently alter your baseline. All of this obviously affects your quality of life and is validated in scientific literature.
A study published in June 2023 revealed that many individuals suffering from long COVID experience a really low health-related quality of life. Participants were given a questionnaire to assess health-related quality of life across 5 dimensions, and these dimensions were mobility, self-care, usual activities, pain or discomfort, and anxiety or depressions. And the findings indicated that long COVID patients reported significant impairments in all of these areas, with their quality of life scores often falling below those of individuals with advanced stages of cancer. And the functional impairments caused by long COVID can be worse than that experienced by stroke survivors and similar to those experiencing Parkinson's disease.
Wow.
Yeah.
You would think that a condition this disabling would evoke some strong support for prevention and treatment options, but unfortunately, that is not the case. There's no one-size-fits-all treatment and definitely no cure. Long COVID can look different for everyone, which makes the cause or causes hard to research and understand. As a novel virus, its complexity makes it hard for health practitioners to treat it or even bring relief to many patients who suffer. Like many chronic illnesses that have come before, relief can only be found through managing symptoms, and that usually means seeing multiple specialists, pulmonologists, cardiologists, neurologists, rehab specialists, immunologists, even mental health professionals just to get by.
Even though long COVID is new, I do want to iterate that post-viral and post-infectious conditions have always existed, but they have simply been neglected by medical research this far, meaning that there is little to no data to build on. The situation today would probably be much better if we would have taken things like post-viral POTS, post-viral ME/CFS much more seriously.
Amen. So long COVID isn't rare. It's affecting millions of people. The numbers vary depending on the study, but estimates suggest that anywhere from 65 million to 400 million people worldwide have had long COVID. And in the US, studies show that about 1 in 10 people who get COVID end up with long-term symptoms. That's around 18 million Americans, but this is per infection. So the risk increases in the population the more infections people get. And one study from the Patient-Led Research Collaborative found that at 2 infections, you are 2.14 times more likely to get long COVID than those with only 1 infection. And at 3 infections, you are 3.75 times more likely to get long COVID. Yeah.
Wow.
People are just stacking up infections, just like,
Yeah.
we're going to have a lot more long haulers.
Yeah.
In Europe, the World Health Organization says that 10 to 20% of COVID survivors are dealing with lingering symptoms. That would be like 1 in 5 people dealing with some form of long COVID or a new COVID onset condition.
Are specific groups or demographics more likely to develop long COVID than others?
Unfortunately, yes. So some groups do report higher rates of long COVID. Women are more likely to develop long COVID than men. In the US, census statistics show adults aged 30 to 50 are the most affected age group. Hispanic and Black adults report higher rates than other ethnicities, and individuals with lower family incomes are more likely to experience long COVID. Finally, and probably the most sad part, is having a disability or a pre-existing condition seems to also elevate your risk of developing long COVID.
Despite so many people being affected with this condition, healthcare systems haven't caught up to be able to properly care for these folks. According to our survey, only about 74% of respondents were formally diagnosed, which means that a huge number of long haulers are left in medical limbo, dealing with life-altering symptoms without the recognition or care that they need.
And that's not even counting those who have COVID-related health issues but don't make the connection that these issues started after their COVID infection, if they even knew they had COVID at this point. It's worth mentioning this survey was taken by folks in popular long hauler groups and communities, so respondents are already pretty well informed about this condition. And this also means that researchers and policymakers are underestimating just how many people are actually dealing with long COVID. So this lack of recognition fuels a bigger problem in society. It downplays the true scale of long COVID, making it seem like it's rare and less urgent and less risky than it really is.
Absolutely. And this leads us to our next question in the survey. We asked, did your provider know what the signs of long COVID are? And alarmingly, only 63% said yes, meaning that about 37% of doctors were unable to recognize long COVID in their patients.
And again, this is folks who are COVID informed. They have made the connection that their symptoms started after a COVID infection. And this raises important questions like, are practitioners appropriately educated about this condition and the various forms it can take? Are they better at diagnosing cases where symptoms start immediately after infection as opposed to weeks or months later? How does the lack of a positive COVID test affect the likelihood of diagnosis? And a common theme in the survey responses is incompetent medical providers who are just not up to date on the current understanding of this disease, or show a profound lack of interest in acknowledging it or providing any symptom management, and instead suggest the cause of all these debilitating conditions is depression and anxiety.
That is so frustrating to think about.
Hmm.
And when we asked people about their experiences with the healthcare system, the responses were all over the place.
Yeah, so while 37% said that their provider showed some level of support, nearly 45% felt dismissed by their doctors.
And even for those who do get a diagnosis, the challenges don't stop there. Finding actual treatment is a whole other battle, usually a losing battle. According to our survey, only 45% of respondents had access to specialized long COVID clinics or care teams. That means that more than half of the patients are not working with providers whose purpose is to understand this condition.
The barriers to adequate long COVID care vary by country and region, but the general gist is that many areas have no long COVID clinics at all, forcing patients to travel long distances or go without that kind of care. Many people also noted that long COVID clinics near them had closed down. And even when clinics do exist, appointment wait times can be anywhere from 6 months to over a year. Some clinics require referrals, and one respondent noted that their PCP wouldn't give it to them because they didn't believe in this disease.
And honestly, let's be real. Even when people do get into a clinic, that doesn't mean that they're going to actually get treatment. A lot of these clinics only exist to diagnose long COVID and to offer basic symptom management, but no real solutions. Some don't even have specialists who understand the full scope of long COVID. And some even offer treatments that can be harmful to patients, such as graded exercise therapy.
And some clinics and specialists are not covered by insurance, making treatment inaccessible to lower income patients. Even if you manage to get into a clinic, clinics vary in specialty and competence. Some clinics are under specific siloed specialties, such as pulmonology. Some clinics focus solely on breathing issues, while others concentrate on fatigue and physical rehab and don't have the wide breadth of specialties that are required to understand this multi-system disease.
And this last barrier is especially frustrating. Many clinics require you to have an official long COVID diagnosis or proof of a positive COVID test before they'll treat you. But that leaves out a lot of first waivers, so people who got sick in 2020 before testing was widely available.
Or those who get sick today, since COVID tests are just not available now.
Yep. So one survey respondent captured the severity of the situation perfectly. And they said, I know other places have it worse, and that's why I find it hard to say I don't have good access to good long COVID care in the context of how other countries treat long COVID. My country does not lock up long haulers into mental facilities or force them into rehab clinics like others do. But there is no adequate care for long COVID here. You are stuffed into some random department of the hospital, in my case, neuroimmunology, specifically MS doctors, who have no idea what they're doing. They send you to occupational therapy and physical therapy, and that's it. When you ask about experimental medications like LDN, so low-dose naltrexone, they say there is no research on it actually helping, and that's the end of the discussion. They don't try to help you at all, and you are left to fend for yourself.
Ugh, yeah, this person is likely referencing the many long COVID patients who are mistreated and then forced into psychiatric hospitals. Time even wrote an article about this issue detailing how psychiatric misdiagnosis leads to medical abuse. And you can find more information about this issue and that article in our show notes. Another respondent said, in my experience, providers specialize in only using a limited number of diagnostic tools, and if your conditions do not neatly fit those instruments, then they will refer you elsewhere or have nothing to offer. It isn't like Dr. House, where they're going to investigate everything. It's more like going to a muffler shop when you have 20 different things going wrong with your car. I felt this in my bones as I was reading it.
Yeah, it is exactly like that. And sadly, with all of these barriers, the long wait times, no clinics nearby, and high costs of care, as well as the providers refusing to diagnose or treat people, many long COVID patients are left to figure out things on their own. They're self-managing their symptoms, bouncing between multiple specialists with long wait lists who don't communicate with each other, and basically trying to be their own doctors and experimenting on themselves.
Unfortunately, the harm done by healthcare providers doesn't end there. Our survey asked whether healthcare providers take proper precautions, such as masking and air filtration, and the results were sadly rather telling.
Yeah, I was not surprised at all when I saw the results, but honestly, it was still really, really frustrating because you kind of want to hope that the situation is better in other parts of the world, but apparently it's just
Hmm.
terrible everywhere. Um, so Jesse, what did we find out?
A staggering 58% say there are no airborne infection control precautions at their providers' offices. 17% said mandatory masking was required only for symptomatic patients, even though we know you're contagious before you have symptoms. 9% noted that their doctors actually wore a respirator like a KN95 or an N95 or FFP2, which was actually a lot higher than my own experience and those around me. So that was kind of like a pleasant surprise. About 8% said their provider wore a surgical mask, and half of those responses said it only happened after they specifically asked their provider to mask.
That's so
And about,
frustrating.
yeah, for sure. And about 6% said it's been a mixed bag. Some of their providers took some precautions and others took none. Of note, only about 3% of offices employed some kind of air cleaning or air filtration, despite the evidence of how COVID and other respiratory viruses transmit through the air.
So what kind of impact does this inadequate infection control have on patients dealing with long COVID?
So, when providers don't take precautions and don't signal that they understand how this disabling virus spreads, it undermines our faith in their ability to treat us. Furthermore, it means we often delay getting timely care because of our concern getting reinfected at doctors and dentist offices. And this can lead to worsening health outcomes for the rest of our health.
Yeah, it's so utterly frustrating to think about. And one person in our survey shared this experience. My primary care provider is great. She's COVID cautious and well informed, but the local hospital and other healthcare providers are not. Not even the local long COVID clinic. I can't get mammograms or emergency care without the risk of getting infected. Healthcare providers in general have been officially instructed to ignore COVID and post-infection symptoms and are gaslighting patients about their symptoms. It took months before I could access a cardiologist who'd take my post-infection symptoms seriously, and it turned out I got a very serious case of pericarditis that had been left untreated for months because I kept on getting turned down when I mentioned I had started getting these problems after a COVID infection.
Mm.
So frustrating. The first rule in medicine is do no harm, but honestly, it feels like the majority of the healthcare providers that we see are inflicting a lot of harm on us.
It's really unfortunate that, like, this is a serious problem that
Yeah.
can be measured, and they just choose not to measure it because someone mentioned that it happened after a COVID infection.
Yeah, and also wearing a respirator to protect your patients and having your patients wear respirators to protect the doctors and each other is such a simple mandate to put in place.
Okay, I'm reminded of Alice Wong's experience. Alice is a disability rights activist and author who is disabled and physically she is unable to mask because she's a full-time vent user with a tracheostomy and uses text-to-speech software to speak. So providers have refused to mask for her, and you can hear her story or read the transcript on the Death Panel podcast that we'll link in our show notes.
It's just not right that these patients who physically cannot wear respirators due to medical conditions are left to be forcefully infected because healthy people simply can't be inconvenienced to put on a respirator.
Mm-hmm. Yeah, so we would like to share a story, a short interview we did with a long hauler named Anna from Greece, where she talks about her experience with her healthcare system. Hi, Anna. Welcome to the show, and thank you for agreeing to speak with us.
Hello, thank you for having me.
Do you want to tell us a little bit about yourself?
I'm 23 years old. I have long COVID since I was 18, so it's kind of like almost 5 years now.
Mm-hmm.
I'm not a student or working right now, like officially. I used to have a really busy schedule. Like before before long COVID, I did competitive swimming in my teenage years. Basically, I was a very active person, and now it has changed drastically. I have to pace myself, a lot of dietary changes, and a lot of doctor appointments.
Were you able to get an official diagnosis of long COVID by a healthcare provider?
I don't have an official diagnosis because there's like a big barrier in Greece. Multiple doctors have told me that I have it and they have agreed that this is what it is, that it's long COVID and post-viral illness basically. But the thing is that in Greece, we don't have like a standard process of getting patients diagnosed. So, yeah, basically, a lot of patients, including myself, we end up managing the symptoms based on the patterns of the symptoms and what has worked for others. And we try to find doctors through each other mostly, like we share information with each other.
Have you been diagnosed with anything else?
I have found out that I have Ehlers-Danlos syndrome, POTS, and also possible MCAS, although that is not fully confirmed. But we're still treating it as if I have it
Oh, good.
because treatment for it has significantly helped with my symptoms. Many of us cannot afford to go to the doctors all the time
Yeah.
since the ones that do listen tend to be private many of the times. So you kind of have to constantly prioritize which doctors are you gonna see and what are you gonna do, which is like most needed.
So, has your experience with healthcare providers been more predominantly negative?
It actually has been very mixed. In the first years, like the early years, I had faced a lot of medical gaslighting. And it actually continued until last year, where I basically reached my worst. And yeah, I was severely underweight because of all these swallowing issues. I could barely walk. I had light and sound sensitivities. Not always, but like I had some really bad days.
Hmm.
And I was scared because until that point, every doctor that I had gone to, they were saying it's anxiety or it's part of being a woman. I also remember once, like, a doctor told me, "You're convinced you got something, huh?" Like something like that. And yeah, it's something that has struck with me till this day since I was like desperately seeking help. And this doctor was like, you're convinced that you got something.
That's so hard to deal with, and especially because there's so many like signs that you're suffering. You're
Yeah.
underweight, you're not able to walk, and they are dismissing you. Is there any other doctors that actually tried to
Yes.
listen?
Like in the past 6 to 8 months, I have thankfully found a few doctors that are actually really great and I really appreciate them. They are not specialists when it comes to post-viral illnesses or long COVID or ME/CFS or anything of that sort. And they try their best to at least help with symptom management. But even so, the reason I have found that is because I'm on the milder cases and I am still able to go to the doctor appointments and be present. So any people that cannot do that and they are, for example, housebound or bedbound and they cannot leave the house, that gets more complicated since honestly most doctors don't do telehealth, like online appointments, and there is this huge barrier of people not being able to access any doctor.
So, no specialized long COVID clinics or care teams in Greece?
We do have some long COVID clinics, and personally, I have avoided going there because I've heard like bad experiences from other patients.
Hmm.
And there's generally this a bit of a concern and fear that there's poor treatment.
So, do they tend to treat long COVID as like a mental illness, or do they force you to do like this rehabilitation program that leads to like PEM crashes?
That's the thing, like from the people that I have heard experiences of, they tend to say that it's mixed because it's in a public hospital and it's like a clinic. It's also about luck, like who's gonna see
Okay.
you at that moment. So maybe a specialist that you'll see at that moment might listen to you and take you more seriously, while another time someone will be treated like it's a mental illness and get completely mistreated.
Public hospitals here are
Yeah.
chaos as well. It's every time you see a different doctor, and every time the doctor has a different opinion on your health. So,
Exactly, it's kind of like that, and it gets so confusing.
Yeah, so what changes do you think need to happen in your healthcare system to better support long haulers?
I do believe that there definitely should be better education on post-viral illnesses,
Hmm.
including long COVID. Too many doctors still dismiss a lot of these conditions. They say it's anxiety or that we're exaggerating. But yeah, it basically leads to patients being dismissed, misdiagnosed, or just ignored for years. I do believe that there should be more awareness about the long-term impacts of COVID itself, that it can lead to all these things. And lastly, medical professionals should try to be more mindful of how they speak to the patients. They should be a little bit more careful with how they treat our mental health. Yeah, I feel like the years of medical gaslighting have made a lot of patients to develop a lot of trauma.
yeah.
And it makes people less eager to ask for help and go to the doctor or make that appointment because we end up being scared of how we're gonna get treated. We definitely should not have to fight so much to be believed, and that would mean that we definitely need more awareness.
Yeah. Well, Anna, thank you so much for joining us today and sharing your experiences with a sadly not so great medical system with long COVID in Greece. Sadly, this isn't the only hurdle we have to face as long haulers. Long COVID also has devastating impacts on employment and education. 94% of our survey respondents shared that their ability to work or attend school has been affected by long COVID.
Yeah, according to our survey, 46% of respondents had to stop working completely, while 40% had to reduce their work hours, ranging from slight to severe reductions, and only 6% reported no changes in their work hours. And many respondents also shared the financial and emotional toll this has taken on their lives.
So one respondent shared, "Work is excruciating. I'm in a constant state of pain and exhaustion."
Another shared, I lost my job, my savings, my ability to provide for myself. I had to move back in with my parents in my 30s. Another one said, I actively avoid large crowds. Having to work in an office where multiple people will show up very sick, like it's some badge of honor to come in and work with the plague, is stressful. And I personally, Jessie, I personally have experienced this. When before I got sick, I was trying so hard not to get sick. I just couldn't believe that we lived through the same pandemic and people were just still showing up sick at work.
Research suggests similar numbers when it comes to people being unable to work due to long COVID. A UCL study found that among patients in long COVID clinics, 72% were missing work after 6 months, and 36% could not work at all.
And this brings us to the issue of workplace accommodations. In our survey, we found that where workplace accommodations were applicable, meaning people weren't remote or they weren't self-employed,
Or not working at all.
44% of respondents did not have them. Of those who didn't have accommodations, about 70% were either denied or were not eligible to apply. 62% reported accommodations were not applicable, with many transitioning to freelance or self-employment or simply not being able to work at all.
So we would like to read some quotes that we got from our respondents. One person shared, "I applied for accommodations. My workplace ignored the request, then fired me during restructuring."
Another said, I was granted remote work accommodations 3 times. I applied again and was denied and threatened with medical separation. Another said, I had to fight for the ability to work from home. No accommodations were available at the office.
That is so frustrating. At this point, we would like to share another conversation we had with Rand, a long hauler from Belgium, about his experience with working and then not working whilst dealing with long COVID. Welcome to the show, Rand. Could you please tell us a little bit about yourself, your life pre-long COVID, and how long COVID has affected you today?
Yeah, I'm 44 now. Got long COVID. I don't know actually how long. It's always a bit hard to say because it goes gradually, right? You start feeling worse and worse, and all of a sudden you realize something's wrong, and you don't know for how long already. But I've been home for more than a year now, almost. Before COVID, actually, I worked mainly on river cruises as a program director. Then COVID hit, and that business got skewed, and I found another job with the Belgian government, a desk job, but one where we do day shifts and night shifts. Actually, a job that I kind of like, but not very impressive either. It's just like sitting there and answering phones. But yeah, then I got at least 3 COVID infections, maybe 4, I'm not sure. And it all went downhill, and I stopped working completely.
What kind of symptoms were you dealing with?
Yeah, so the most noticeable symptom for me was fatigue. I didn't know where it came from. It was just I was extremely tired. The moment I stopped working is when I almost crashed my car on the way home from work. When I
Oh
really
no.
realized like this isn't okay anymore. I just fell asleep behind the wheel. I mean, everything was fine. I didn't crash my car, but it was really a close call. And then I was like, yeah, okay, this is not okay anymore. I have to stop working.
Eventually, you did try to return back to work. How did that go?
I work for the government, and they have a system in place that kind of forces your employer, so the government office you work for, to listen to the doctors. So the doctor says I can work part-time and not more, then they can't do anything else and put me back at work part-time. So that's what I did, and it didn't go well. Part-time is still a lot. I
Mhm.
thought I was ready for that. Turned out I wasn't. It
How many
tired me
hours?
out completely. 19 hours a week,
Oh
something
my
like that.
gosh.
So there's a lot of communication issues going on in that whole process. So it sounds very nice, right? That's my job should be listening, but in
Yeah.
reality, that's not really what they do. So what happens is I went to my neurologist. She said I should only work like 40% or so. She already thought 50% was too much. With a report from her, I went to the medical office of the government job. They said, no, sorry, we only do 50% or more. We don't do less than 50%. And the thing is that I work in shifts, right? So you have day shifts, night shifts. And my neurologist said, yeah, stay away from those night shifts for now. Not a good idea. And I said, yeah, okay, the day shifts are shifts of 11 hours. And she said, no, let's not do 11 hours at once. And I'm like, no, I don't want to do 11 hours at once. And the medical office of the government that I went to also said, yeah, you're right. 11 hours, it doesn't make sense for you. Problem is that in the thing that they made up on paper and then sent to my job itself, where they have to give me my schedule, they only said that they and me could agree on how many hours actually should be done on a day. They thought like, aha, that means we can demand 11 hours. And
Ugh.
that's what they did. So yeah, I just bumped into a wall, went to my doctor and said, please just put me home again.
So then you're no longer working. What is life like now that you're back to not working?
There's been a very recent shift. When I just first stopped working again, I fell into a real black hole. Like the biggest depression I've had since long COVID was then, because I thought I would go back to work. It all failed, and then yeah, your walls collapse. I have actually mentally already decided that I'm going to quit my job. I haven't done it officially yet, but I will. And I want to go back to what I did before that, because COVID is not over, but everyone thinks it is. So the cruise business is running again. And I had passion there, and I want to go back to that. And I actually think to a certain level, I'll be okay with it. If I go on a cruise, it's for like 14 days, no days off, which sounds insane, right? For someone with long COVID. But on that job, I can pace myself. So the energy I feel now with taking this L-glutamine, sleeping at night, it's still way lower than before long COVID. But it feels like to be at a level where if I pace my day carefully, I can actually do stuff again. And on these ships, I have to do certain things, of course, but I can also go to my cabin during the day, disappear for an hour or two, and then be back all smiley, and then again disappear for an hour or so. That's all doable.
Are you currently getting a certain percentage of your income from your employer or from the government?
Yeah, I'm in Europe, so I do get benefits. In the beginning, for a year, actually, I got 60% of my wages, 60, which is actually not enough. But I mean, it
Yeah,
sounds nice, but
it's an
was especially
adjustment.
with all the expensive therapies and supplements and all of that, life becomes more expensive and you earn less. It's not good. And then after a year, I should have fallen lower because then I would go to full disability. But that's actually when I started working again at 50%, and that sort of resets this thing, it seems, because they're again paying me 60% now.
If you had a magic wand and you could make employers understand your situation, what would you will them to understand? Like, what changes do you think need to happen?
Oh, they need to learn empathy. It's the main thing. They just need to listen when you're talking, even when we get frustrated and or maybe not communicate 100% clearly what our actual needs are. They should, instead of pushing their needs on us, try to really understand what our needs are. I can really work. I really can. I know I can. I just have limits, and they do not want to listen to me telling them about those limits. They only want to listen to a piece of paper telling them this person has these limits, and that's why you're gonna do this now. And that's insane. I'm a person. Listen to me. So, like one of the simple things is don't give me a fixed start and end moment of my day. Let me come in when I am awake, and let me leave when I feel too fatigued. And of course, in this day and age, telework. Let me do stuff from home. Why on earth
Amen.
Yeah.
do you need me to go to that office?
Do you have any advice for people trying to manage work with long COVID?
Big tip I can give here is don't forget your passions. If you are thinking about going back to work, think about what you like to do, and that's where your time investment should go, because otherwise you're going to destroy yourself just the way I destroyed myself by going back to an awful job.
Thank you so much for joining us today, Rand. Not only are people who work affected by long COVID, but also students, both at regular grade school and at universities, are also struggling to complete their academic studies with long COVID. According to our survey, 61% of respondents who were in school at the time had to stop studying completely, while 29% reduced their course load in some capacity. Only 10% noted no change in their course loads. One respondent shared, I was fired from my PhD studies. My supervisor didn't believe in my symptoms.
Only one person had a positive story to share with this question. They said, the administrators at my school are aware of my light sensitivity issues and are supportive, even allowing me to leave school early to see specialists.
Oh my gosh, I wish I had a positive experience like that to share. I was at university for my bachelor's degree when I was disabled by long COVID, and I was essentially forced to drop out of university by my own university, and I had to give up my degree. But I do believe that I could manage a very small course load, but it was simply impossible to get the adequate accommodations, both from regular universities and online universities.
I'm so sorry.
Yeah, it's so frustrating.
And sadly, our survey results showed the same trend. Universities denying students the necessary accommodations to have equal access to education. School accommodations were hard to come by. Only 47% of student respondents reported having them, while 33% either applied and were denied or were unable to apply. And one person shared, I've applied to multiple universities in hopes to eventually finish my degree, yet every university I've contacted was unwilling to accommodate me. I was told I should wait until I recover from this condition, as if long COVID weren't a complex chronic condition I may never recover from.
Another person shared, the university refused to accommodate me because my condition is, quote, too complex and that I should look into a different kind of education.
Our next guest is Kai, an American student who is currently studying in the Netherlands. Welcome to the show, Kai.
Yeah, of course. My name's Kai. I am 21 years old. I study international law here in the Netherlands as
cool.
a non-European student.
Can you talk a little bit about how long COVID has affected your ability to attend your classes and complete your program?
Yeah, of course. So I got long COVID at the end of my first semester here in university, and I'm currently in my third year, just for reference point. So I kind of have like a night and day comparison of what it was like before having the condition and what it's like now. But also I have the experience of when I was getting testing and all of that.
Mm-hmm.
Um, but like majorly I've had fatigue, which has made it to where I can't physically get to my lectures. I can't sit in them long enough to absorb the content, brain fog mixing in with that to where it's just in one ear, out the other. I can sit
Yeah.
there, I can have notes. I have no clue what's going on. I'm not connecting.
I can
Um,
relate to
Oh,
that.
yeah. With that, I've had pain issues regarding my mobility and stuff like that. So actually getting to the classroom has been majorly problematic. But it's definitely been a challenge for sure.
And because of all of these issues, have you had to reduce your course load or even take breaks from university, or has university been able to accommodate you in a way that you were able to continue your lectures and your degree as usual?
So as things are, I somewhat have a delay, somewhat not, kind of. It's a little funky. So the way my university operates, specifically because I'm a non-European student, so this policy applies differently to European nationals versus non-European. I have to meet a certain credit threshold every year, otherwise I will lose my visa.
Yeah.
stressful.
Very stressful. Although there are additional circumstances for disabled students, chronically ill students, and stuff, they can only cite chronic illness slash disability one time in your studies. So you can only be delayed one semester maximum. There's also other flaws in their policy where it's like you can only report disability in your first year of studies. Heaven forbid you become disabled later in them. So
Gosh.
although I've like definitely wanted to and considered reducing my course load, because of that strange policy, it's been very stressful to try and figure out if that's a chance. My university also like blocked all recorded lectures and stuff like that and deleted the previously recorded ones as well.
Why do
So
they
it's
do
very
this?
much show up to class or you're not getting anything. And in my program in particular, it's if you're absent twice or more, you automatically fail.
Has your university been able to give you specific accommodations?
Yeah, so when I first reported to the university, I reported while I was in ongoing testing, because I developed long COVID in December of 2022, and I only officially got diagnosed with long COVID in December of 2023, so I had a year of testing, and now it's 2025. I reported while I was in testing, and the only thing they would give me was an extra 30 minutes for my exam, and I could take my exam in a different exam hall than others. So instead of being with 200 other students, I'm with 20. And I'm like,
How does that
okay,
help you?
how
I
is
mean, I
this
guess it
helping
could
me?
like, yeah, like cut down on like mental
Transmission.
stimulation or
Transmission
like the,
element for sure.
yeah.
And then they gave me that for one semester, my second semester of my first year. And then the start of the second year, they took it all away. So I was like, hey, I'm still having these problems. I'm still in testing. Here's proof, and just showing more and more medical documents. So they did give me some accommodations, but it really was not sufficient for what I needed.
Yeah. So it sounds like they gave you a little bit, which wasn't sufficient, and then they took away that little bit. Is there any other kind of support you've gotten from faculty in terms of scheduling or even the ability to attend lecture hall with like a mobility aid?
Yeah, so pro and con. As I study in the Netherlands, a lot of the physical stuff is wheelchair accessible because bikes are the main mode of transit here.
Mhm.
I've definitely had instances where even though they have it in the scheduling system that I'm a wheelchair user, they put me in non-accessible facilities. Or there was a case where one elevator on campus was broken for 2.5 years straight. I had to carry my walker up 2 flights of stairs to get to an exam before.
I guess your university was not very good at managing all of that. Were at least like your classmates and maybe singular professors helpful, or were they also just ignorant and just didn't care about your situation?
I would say it was pretty mixed box in all honesty. Like I had some classmates where it's like the moment they would see me in my wheelchair, they'd pretend I didn't exist at all. So like
Wow.
they would take the very back row, which is the only wheelchair accessible row of the lecture hall. So it's just like, do you want me to block the doorway? Like where do you want me to go? Students like offer to push me up ramps and stuff like that because the ramps on campus are very, very steep. So I always have to get assistance in my wheelchair. Um, so I've had very variable experiences with students, and for professors, I've had a spectrum of experiences. One where it's, okay, I heard you have a fatigue related disability. How can we accommodate this in the classroom? Do you need breaks? How can we additionally support this? Like how can I make the course more accessible to you? Do you want the material beforehand? Like actually collaborating with me, meeting me with me directly and
That's
communicating about this.
amazing.
To the other end of the spectrum being called a slur by a professor.
Yeah.
Dude, what? Based on your experiences, what do you think that they could improve and do better in general?
Honestly, there are some buildings that just physically were not built to be accessible, which It's especially disappointing given one of them was literally just completed in construction a few months ago. And I would say generally open-mindedness, because like a lot of the pushback I got was initially like, because I was in ongoing medical testing and stuff. Like, I'm like, okay, do you want me to send you my test results? Like, how do you want me to manage this? Where it felt like it was a system based on distrust rather than a system based on trust, where it's here's all your documents that you constantly have to prove to us, and every 6 months we're going to ask you to reprove that you're disabled, which is a traumatic experience for a lot of
And
us, and it's
for
very
what?
emotionally draining.
Do you have any advice that you would give to students dealing with long COVID and the entire administration and university and all of that?
The main thing, although it is tiring as hell, is to keep fighting. Because the moment you stop, the university will chew you up and spit you out without stopping. It will not care about a single student. Unfortunately, from my experience, that's what it's been like. So keep fighting as much as you can. And if you can't physically do it, if you can't handle the fight, get others on your team as well. That's how like potentially students suing the university, new study association fighting about accessibility, really get people informed about the difficulties you're facing and how unjust it is. But if you want to pursue education, you should have every right just as much as other people in that classroom because you're paying just like they are.
Yeah, thank you so, so much for sharing this with
Yeah.
us.
Because so many long haulers are unable to work and struggle to get accommodations at both work and school, many struggle with financial stability.
Our survey showed that long COVID has left 91% of respondents financially impacted, of which 44% said they were severely impacted, struggling to cover basic expenses, and 47% were moderately impacted, but still faced financial strain.
And research suggests similar numbers, right?
Yeah, a CIDRAP report found that approximately 17 million adults with long COVID face employment and material challenges in the US, with 40% reporting food insecurity, 20% struggling to pay rent or mortgage, and 10% having to stop working temporarily due to symptoms. Study participants in the lowest income group reported being at risk of losing utilities and struggling to pay bills. In contrast, only the two highest income groups did not face these economic challenges. Is anyone surprised? The authors noted that the wealthier individuals with long COVID were more likely to have the resources to manage the short-term impacts and the job flexibility to work from home if necessary. One survey respondent said that the most challenging part of long COVID is financial insecurity, that if I didn't get better, I would lose my income. Speaking as an American, I cannot overstate how terrifying that is.
Yeah. Many also reported difficulty affording medical care and treatments. A study showed that primary care costs for long COVID patients in the UK was increased by 43 to 44%. And there's also an increased need for different therapies, medications, and supplements. These are all costs that many long haulers need to cover themselves, as not everything is covered by insurance.
Yeah, this burden could be made so much lighter through actual disability benefits or income.
Yeah.
But many patients they encounter challenges when applying for these benefits. So our survey asked if respondents had access to disability benefits. Only 17% are receiving aid at this time, and 64% said they did not have access.
What were the reasons why people were not able to get the financial aid they need?
57% were simply not able to apply for different reasons, like long COVID not being recognized as a disability, or because such institutions just don't exist in their region. One shared, long COVID is currently not a recognized disability in my country. I can apply, but it will be pointless. So 22% plan to apply, but haven't yet. So good luck. And another 17% of those who applied were unfortunately denied.
Wow, that's an absolutely horrifying number. Do you know how these people are getting by without any kind of financial aid?
We didn't ask that question in the survey, but quite a few people noted that their partners, parents, or other family members have been their main support so far. Many describe how they had to move back home to their parents or are now depending on their partner to support them both with that income. One problem that we see discussed a lot is long haulers who reside with family who don't take precautions to protect them from reinfection or are outright dismissive and abusive. And these are the folks who are, quote, lucky enough to have people in their lives that can care for them financially. So it's just really a heartbreaking chain of events and circumstance.
Absolutely. And also, that leaves no margin for error if your caretaker becomes disabled themselves, long term or
Mm-hmm.
short term. That puts you in much more economic risk. With so many people being unable to work or being forced to reduce their hours, these individual hardships add up to something much, much bigger. The economic impact of long COVID isn't just simply affecting patients, it's also reshaping the workforce, straining healthcare
Mm-hmm.
systems, and costing businesses and governments billions. What does that look like on a larger scale, Jessie?
So, a report by the Brookings Institute shared that up to 4 million Americans were estimated to be out of work due to long COVID. And this means that long COVID could account for up to 15% of the 10.6 million unfilled jobs in the US at the time of that study.
Yeah, the financial impact of long COVID is staggering. In the US alone, lost earnings due to long COVID are estimated to be between 170 billion and 230 billion dollars per year. On a global scale, the economic loss is even more severe, around $1 trillion dollars annually. That is roughly 1% of the world's GDP.
Living with long COVID is tough in so many ways we've already described, but one of the hardest parts is how it impacts your relationships. Friends drift away, family doesn't always get it, and even casual hangouts can leave you completely wiped out. Some people stop checking in, while others act like the pandemic and therefore precautions are over and done. Social gatherings that used to be fun might now feel stressful or even unsafe for you. In this part of the episode, we're sharing personal stories about how long COVID affects social lives and connections.
In the survey, we asked, how has long COVID affected your social life and your relationships?
So, some have lost their ability to socialize due to the limitations of their symptoms. So, we'll read some quotes here. One person said, I'm too fatigued. I have shortness of breath when I try to have a conversation. I can socialize a little, but then I have to rest for the next few days. I can't dance with my boyfriend anymore. I can't party with my friends or family.
Another person shared, I can't maintain relationships due to my constant health problems. There is a lot of stigma with health problems in general, and even more with anything COVID related due to all the propaganda. So I've lost many relationships.
Another one talks about dating. They said dating has not been possible for several years now. Even messaging on online platforms can be too much for me at times. I've now accepted that it's very unlikely that I'll meet a partner anytime soon due to having such a limited social life and would not be able to offer much in a relationship in any case.
And the last quote we would like to share here said, I have far less friends now, but the ones I do have are some of the closest and most wonderful relationships I've ever experienced, due to how we have bonded and cared for each other ever since I got long COVID. I would never have moved in with my partner and friends if I had stayed healthy, and my life is much better in many ways because of that, even with my extremely limited capacity and scope of life. I just got like goosebumps. It's
Yeah.
like a little bit of
There
positivity.
Yeah, there is some beauty in all of this terribleness
Yeah,
that some people can find, and I'm just so grateful for that.
yeah. Sadly, others have also been isolated from friends and family. One person shared, I lost friends and family because of lack of understanding. I had a very busy social life, and now there's nothing left.
Mm. Another one shared, I have just one person in my life. All the rest have disappeared and no longer call or visit.
Another person said, I have been abandoned by almost all of my friends. People treat me like a freak. Nobody makes the effort to understand what I'm going through, and they don't mask to help keep me and themselves safe.
Friends and family don't react well to long COVID. When we ask the question, how have friends, family, or coworkers responded to your illness? Have you felt supported or misunderstood? We received some very telling responses.
Yeah, the majority felt largely misunderstood, with only a few feeling truly supported. Others faced constant misunderstanding or even outright abuse, gaslighting, and insults.
So here are some of the responses. One person said they're curious, as in their family. They are curious and supportive, but ultimately completely unable to understand how bad things are.
Another person shared, I felt mainly misunderstood. Most people have been affected in some way by the misinformation and propaganda, so most people look at me weird or dismiss me or even ridicule me for suggesting COVID might be dangerous. And simply telling people, yeah, I have a post-COVID condition is enough to make them very confrontational. I wonder if I said I was disabled by polio, would they have the same reaction? I think not. I love this
That's a great
quote.
one.
It's amazing. It summarizes the entire situation.
Another quote said, some have been supportive. Most don't want to hear about anything COVID related. Some family members have been downright physically abusive and have forced exposure on me against my will. That is just not okay.
No, it's not.
I'm so sorry for you. Whoever you are, I'm so sorry.
Yeah, many have also experienced issues with friends and family not recognizing COVID as the crisis that it is, and hence being unwilling to follow precautions. One response we got said, I am very hesitant to go to indoor places to eat when my family wants to go out. I usually do not. I've missed out on events because of this, but at those same events, there were always COVID exposures afterwards.
Yeah, I can testify to that.
Yeah.
Another person shared, I cannot go out to meet people and often don't even have the energy to have guests over. And then there's the risk of infection that no one takes seriously. And seeing someone for 30 minutes just isn't worth getting sick to me.
Yeah,
Amen.
I agree. Another person was talking about their daughter with long COVID and said, people are supportive to her face, and then nobody will mask to protect her.
I would say that is not support at
No,
all.
no, it isn't. This is quite socially isolating and makes many long haulers feel very lonely, understandably so. The survey respondents described it best. One person shared, I still try to socialize, but I really don't get any enjoyment from it anymore. I've regretted almost all attempts at doing social things.
Another one said, my world has gotten so small.
My heart goes out to this person. Another response we got said, I was once a very community-oriented person who volunteered all the time. Now I feel like discarded refuse.
And many have been abandoned but found a new community online, thankfully. So another person shared, I have been abandoned by pretty much everyone in my life. My nuclear family is great, but I have no one else. I've never had many friends and was always more of an introvert, but this kind of loneliness is unbearable. I'm really thankful for the great long hauler friends I've made along the way. They understand what I'm going through and properly support me and don't tell me I'm crazy or overreacting.
I love
Amen,
that.
friend.
I love that. Yeah, so if you're a friend or a family member of a long hauler wondering what you can do to help someone living with this disabling condition, then you're in the right place. You're definitely going to learn a lot about how you can be a good ally simply by listening to this podcast. But you can also find a great resource by the Long COVID Advocacy Group on how to be a good support system for a long hauler in our show notes. We also created a ally cheat sheet that you can also find in our show notes. And I hope that you will use these resources to become a better person around people living with chronic conditions and disabilities. People have also had to give up or drastically modify activities they once loved, from exercise and socializing to even basic tasks like cooking, working, or brushing their teeth. Some are housebound or even bedbound, unable to do much beyond surviving. When we asked the question, what activities have you had to give up or modify due to long COVID, many long haulers summed it up in just one word, everything, because everything has changed for them.
Another person said, I've had to modify literally everything I do, right down to everyday acts like breathing, eating, and sleeping. I have to breathe deeper and slower to avoid my heart rate increasing and activating my sympathetic nervous system. I have to eat far, far smaller meals to avoid flare-ups and digestive issues. I have to have an extensive bedtime routine to get me calm enough to fall asleep and sleep through the night. Most of the things that come to mind when able-bodied people think of activities are either completely off the cards for me or heavily modified to what they were pre-long COVID. I can no longer go to concerts, parties, shopping centers, play most video games, watch a movie the whole way through, have sex without taking breaks every few minutes, read physical books, etc., etc. The list is basically endless. A lot of athletes responded. So one person said, I used to exercise 5 to 6 days a week, and now I can barely take care of myself.
Some are also unable to engage in their favorite pastimes. One person shared, I can't watch movies, I can't read, I can't even listen to music anymore. Another person said, and I really feel this one, is the worst one is, I can't walk my dog. It's just
Yeah.
heartbreaking not to be able to do that one thing you love for the
And they don't
pet that you love.
understand.
It's heartbreaking. Oh, yeah.
And others grieve the active lives they once had. One person said, I used to love hiking, playing with my kids, and traveling. Now I'm mostly confined to my house.
So I think every long hauler will hear these and say, oh, this one describes my situation perfectly, I think. Even though all of our symptoms are so different and all of us have such different experiences and a lot of things, I think the general gist is that our lives have become much smaller and we are unable to do a lot of the things that we really used to enjoy doing. Last month, we spoke to Matt, who suffers from severe chronic headaches post-COVID. And we had a conversation about how we have to curate our social activities and censor ourselves around some friends. And here's a little snippet of the discussion we had.
Yeah, it makes maintaining relationships extremely difficult because I will have quite a hard time seeing other people because it can depress me quite a bit. It's like you put on this performance, you perform like you're okay, and you can laugh and have conversations, and you're sitting there listening to somebody talk about their job and their plans for the weekend and what they did the last holiday. You're listening to them talk about their normal lives, and meanwhile you're just thinking to yourself the whole time, my life is completely destroyed. I can't do any of these things that you're talking about. I can't relate to any of these things that you're talking about. And while you're speaking to me, I'm also in a pretty significant amount of pain. But you're also continuing to put on this performance because the alternative is acting the way that you feel and dropping the performance, at which point all of your relationships will abandon you. They're not going to stick around and deal with that. And understandably so, in a way, I guess. But it's like you're screwed either way. Like you either put on the performance to maintain the relationships and deal with all the depression that comes with that, or you drop the performance and everyone abandons you and you're all alone.
It's nearly like there's no space for us to exist in this world with our disability or chronic condition as ourselves. I think there's just so much pressure for us to pretend to be like, oh yeah, I feel like I'm dying every day, but I'm fine. It's normal. And in a way, it is our normality. We have, in some way, I guess, embraced it as our new reality, as the world that we live in now. But that doesn't mean that it's actually okay or fun to live with. And it's really, really hard to kind of lose these friendships because you talk about your condition too much, or to have to minimize it to keep friendships, because then you're not really being yourself. If you can't show that you're in pain or can't use your mobility and disability aids in front of these people, then it makes just it puts a strain on the relationship.
I can relate to this too, in the way that I was doing a lot of stuff outside this summer because it just makes me feel good to be outside and just observe the butterflies and the bees and gardening and stuff. And I would talk about this stuff with a friend, positive things that I was experiencing, because the negative stuff they don't react to, they don't respond to. They just they're like, oh, that was too heavy, or sorry, I was having a bad day, so I couldn't listen to your message or read your message, or they can't relate to it. And it's just they see you as toxic. So then, I adjust myself and I start talking about, oh yeah, there's this great thing. And then a couple months later, this friend says to me, I know you're really struggling, but I really admire, I love your life. And I'm like, you mean the life that I very carefully curate to be comfortable to you? Because I want to maintain this relationship, and I'm very careful what I share because I know that it's heavy for you. And now you think that my life is good? It was just a really confusing situation. But like I mean, what you said is exactly what I was experiencing, that like
Mhm.
you have to self-censor with friends sometimes just to keep them around, and then they kind of get the wrong idea about what your life is day to day.
They kind of think it's fun to be at home in bed all day because they're tired of going to work, when in our reality, we would love to be able to, maintain a
Yeah,
job. We would love
right.
to be in a crammed train full of people on our way to work or our way to university. We would love to fight with our
Oh.
bosses, or go to a family gathering and yell at our family members. We would love to be able to do that, but we can't. And I think it's like you miss the things that you used to dread and hate because your life has become so monotone, and so
Yeah.
it's just medical labor at some point. At some point, your entire life is filled with surviving and going to doctor's appointments and to therapy and taking meds, that, anything would be more interesting.
You want
Yeah,
to be able to have choices and make them. And now we have such limited choices,
yeah,
and we have to hide those limited choices too because it makes other people uncomfortable. So,
yeah. Sorry, now we made this all about us.
yeah, sorry, that was a long tangent, Matt. Sorry.
Yeah.
I feel all of these same things that you guys are mentioning. I'm glad that you guys could put it into words, because it can be difficult for me to
Yeah.
describe all of this and put it into words. But all of these things that you're talking about, I feel every single one of them.
I think these are just so universally relatable to long haulers and anyone who deals with a really debilitating chronic illness or disability, that we are abandoned, and this reality that we have to curate to show other people does not reflect our reality at all.
Because long COVID is so isolating, many long haulers find support in online communities, which is where Emerson and I met.
Yay!
These can offer the needed emotional support and can be helpful to find different kinds of therapies, different meds or supplements that might be worth trying.
Yeah, in our survey, we asked how many people had joined a support group, and we found that a whopping 92.5% had joined some kind of support group. Jessie, which platforms were the most popular?
Reddit comes in at number one at 57%, which is no surprise because Reddit
Yeah.
is has been historically a very good forum for finding information. Facebook groups came in at 39%. Discord servers, they came in at 24%.
Yeah.
And there's a bunch more that you can see in our data when we release it. But in-person support groups were the least preferred option, likely because only very few exist. And of course, the physical exhaustion of attending, as well as the added risk of infection. And probably also that it's scheduled at a certain time.
Yeah.
And like, how can we keep a schedule? We're just
Yeah.
flaring weirdly all the time. So that's what's great about
Yeah.
online communities.
You can do it from bed. Yeah.
Mhm. Support
Yeah.
on demand, as Emerson calls it.
Exactly. So some respondents also shared why they love the online communities they have found. And one person told us that the online communities help them feel less alone and keep up to date with the latest long COVID research.
One person said, I wouldn't be here today if it weren't for these amazing online long hauler communities. So we're so glad that you're still
Yeah.
here.
Yeah, I can only agree with what the respondents shared. Our Discord server was life-changing for me. The kind and helpful people like Jessie that I have found there have been the support I needed to get through all of this. I also really like following COVID cautious folks and long haulers online, as it helps me feel a little less alone and isolated in my suffering. It's really tough seeing people who are traveling and living full lives. So it's really nice to be reminded that I'm not alone in this. But it's also always great to see people masking on your Instagram feed, since that is something that is considered so awkward. I always smile when I see someone with like a high quality respirator on my feed. It's like, yes, a good person.
I comment, thank you for masking.
Yes, I will literally, I think, share every single post in my story and be like, I love seeing people wearing a respirator. Yeah.
And to your point, like all of us can relate to how important it is to have connection through difficult times. So, like a bad breakup or a divorce, the death of a loved one, or the death of a
pet.
cherished pet. Yeah. I can't, it's terrible. And so, in those really hard times, we always want to seek out people who understand, who empathize, and who show that they care. Connecting with other long haulers has been one of the most rewarding things I've experienced. Like, we long haulers are so limited in what we can do, but we never limit ourselves when it comes to empathizing with others who are struggling. It's pretty extraordinary, especially in today's world. And there's no substitute for someone saying, I'm so sorry you're struggling. I get it. I hear you. I see you. I know. And you don't have to spend your precious spoons trying to be understood. It's a lifeline, especially for long haulers who have dismissive or minimizing loved ones. So if you're looking to find a community online, you can find a list of communities in the Substack post linked in the show notes.
Yeah, and beside all of these amazing online communities, there are many different support resources that might be worth checking out if you would like to stay up to date with the latest long COVID research and awareness. I personally really enjoy the Berlin Buyers Club. They make really amazing stickers and posters and t-shirts, which I'm going to be buying one soon, I think. I also really enjoy the Sick Times and the Gauntlet. There are definitely many more resources that exist, and you can find more information on them and other resources in the Substack post in the show notes. Our next guest today is Nita, who created a wonderful resource called the Spooniverse Directory. Hi, Nita. Welcome to the show.
Hi, thanks for having me. I'm super excited to have this conversation.
Thank you so much. Would you like to tell us a little bit about yourself first?
Sure. So I'm currently a first-time biotech founder, a patient advocate, and a science communicator. So I spend all of my time basically divided between research into therapeutics, patient advocacy work, and communicating basic concepts of science, especially as it relates to stuff in the clinical realm, whether it's like diagnostics, treatments, and being a patient myself, I'm like primarily focused on complex chronic illnesses. So energy limiting diseases, including ME/CFS and long COVID, but also connective tissue disorders like EDS, neurological conditions like POTS and other dysautonomias, and immune disorders like mast cell activation syndrome.
You joined us today to talk about the Spooniverse Directory that you created. So I wanted to ask you what the Spooniverse Directory is.
Definitely. So Spooniverse, it's basically just a portmanteau of Spoonie, meaning patients who deal with energy limiting diseases, and universe, so like the ecosystem of healthcare navigation. And so basically I was just like, I'm just going to smash them together and call it the Spooniverse Directory. And it was basically a reaction to a lot of the issues of navigating healthcare and having so many different resources just splattered across. So it's like, oh, I got to read these books. I need to bookmark these doctors, that patient Facebook group that I need to get back to. And it was just like, I feel like I'm just too scattered and I need something more centralized. And another thing is like, there's all these hidden gems. And when you're in the patient communities, you know, people might share them on a Discord channel, for example, but it's not really something you can find with a Google search. And I was like, I feel like we need a place to find all of these things at once. And this was basically just my attempt to like collate all of that information, you know, through recover groups, through places like SolveME, through Discord groups, Facebook groups, patient support centers, and just have it in one place. Anything that you needed from like finding a clinician, figuring out which diagnostic testing is appropriate, finding patient communities. There's a directory for COVID conscious therapists, books that are relevant, podcasts that are relevant. So this particular podcast is listed in the directory, for example.
Yeah, I love that because that's one of the biggest things I think for patients when they first kind of realize that they're in trouble, right? They're like, what is wrong with me? I have long COVID. My practitioner doesn't understand it. My family doesn't understand it. Society doesn't understand it. Having like one place to kind of like collate all that, that's just such a needed thing.
One of the categories in the Spooniverse is explainers, guides, and visuals. And that has a lot of PDFs and other types of documents that you can give to a clinician or a family member, you know, just to explain this is what POTS presents like, this is what long COVID presents as, because it is kind of exhausting for you as a patient to explain those things. Like one of the resources is called Why Your Patient is COVID Cautious, because I think that the consequences are very real and present for so many people still. So it's nice to have that placed into words and it's succinct enough so that you can hand it to someone without having to spend your spoons on having to explain it to them and try to convince them. And I think that's also just a learning lesson in the sense that I think as patients, we always have to identify who is interacting with us in good faith, because you can get burnt out trying to convince people who are just hell-bent on psychologizing or minimizing the impacts or the long-term impacts of COVID or any other infectious condition.
There's explainers for healthcare professionals, for family. Is there anything else that you want to talk about in terms of like wayfinding? Like what's an easy on-ramp to this?
Definitely. I'm definitely hoping to make more demos, just showing people how to navigate. I think clinics and providers is probably an area that a lot of patients might benefit from. And I do have information about where each clinic is located. You can search by location, but a lot of these lists are also patient approved. Some of these lists are made by other patient advocacy organizations.
Are these lists more centered around the US or North America, or is it more international that there's also lists of clinics and specialists in Europe, Asia?
Great question. So the majority of resources are focused on North America. However, there are quite a few things that are specific to countries in Europe as well. I'm always trying to expand the geographical focus. I don't want it to be just only relevant to North America.
Yeah.
Are some wider maps, like there is a map of MECFS doctors that's more worldwide and all encompassing. But that again is mostly focused on North America and Europe. And I'd love to have, resources for other parts, because it's not as though patients in Asia and South America are not affected. I just think that maybe it's harder to, gain access to healthcare and have such an open dialogue in some of these other places.
Yeah, and I think also this could be a call out for our listeners too, that if you are familiar with some of these more local patient advocacy or other resources in those countries, in those areas that we're missing, like we welcome that. Like, and how would they sort of get in touch with you if they wanted to add on to the Spooniverse directory?
Absolutely. So when you go to spooniverse.directory, that is the URL. In the header itself, there is a button that says submit a resource. And so that will lead you to an Airtable form, and you can fill out anything that is relevant that you would like to see added to the directory. I tried to make it as simple a process as possible. If you're not able to fill out all of the fields, that's all right.
Have you gotten feedback so far from the community about folks who have used this?
Yeah, it's pretty new, so feedback is still trickling in. And I understand some folks might not have the spoons to offer feedback, but I've heard from patients who have found a doctor through the directory, and more often than not, people find at least one patient community that they were able to join as a result of using the directory. And I mean, it's still a very much a living resource, a perpetual work in progress. So hopefully it'll find more utility, and hopefully over time I find more ways to make it accessible to more people.
How do people access the Spooniverse directory, and how do they use those cards with the information, with the links or PDFs in them?
So you can go to spooniverse.directory to access it. And there's a few different ways you can go about navigating. You can click on any one of the categories. There's 16 of them currently. And so you can browse by category if you would rather. But also, if you're trying to search for something specific, you can type that into the search bar. So for example, if you want resources on MCAS, you can put MCAS in the search bar, and anything that is relevant to that will come up. So it's up to you. You can browse by category or search. And once you find cards that are relevant to you, if you click on the top part of the card that has the image, that will increase the size of the image and so that you can see it more clearly. And if you click anywhere else on the card, it'll expand it so that you can see a description of that resource and a link to access it directly.
All right. Thank you so much for joining us, Nita.
This leads us to the last topic of this episode, long COVID awareness and advocacy. One of the most striking takeaways from the survey is just how invisible long COVID still is to the world 5 years later.
Yeah, this was once again not a surprise, but it is still striking. When we asked if long COVID is adequately recognized in healthcare systems, 90% of the respondents said no. And public awareness is even worse. When asked if there is enough general awareness about long COVID, 100%, so everyone, said no.
We asked people how society's attitude toward COVID and long COVID has affected them, and the responses were brutal.
Yeah, the response we got about the impact of lack of long COVID knowledge and awareness, as well as the minimization of long COVID, are really heartbreaking. The first one I would like to read is, "I'm disappointed in society and angry we're not protecting the children. I distrust the government and medical community. I'm treated as less than and have to bring my husband to appointments because I won't be believed."
Another person said, "I know now that people would rather watch you die then learn about the hell of long COVID and their own vulnerability. Society would rather we just die.
Yeah. The next one is very iconic. Society clearly hates that I exist, and the feeling is now mutual, which same.
Another person said, when I had cancer, I was called a hero battling it. Now that I'm battling long COVID, I'm just annoying.
I hate that for that person. I'm so sorry. The next quote is, I didn't know I was at risk for long COVID until I got it because society doesn't talk about this. If I had known, I think I would have taken more precautions. I got COVID once, felt fine afterwards, and assumed I was safe until I got it again and ended up with long COVID so bad that I started to think about suicide because I couldn't do anything but lie in bed oftentimes. I still worry that I will catch COVID again and my long COVID will worsen, and then I fear I may end up killing myself. I am not suicidal, but my mental health is not good, and this has made it much worse. I'm so sorry. Whoever you are, I'm so sorry.
So many of us understand this feeling. The next quote is, it's enlightening to see the lengths that the government will go to normalize death and disability, and how people are quite happy to go along with this so long as they are not inconvenienced.
Yeah.
It's difficult to watch people put themselves in danger every day, but more difficult is how self-important they feel in doing so, and how many microaggressions my very left-leaning justice warrior friends, family, and colleagues are comfortable with subjecting me to.
As
Amen.
someone who is friends with like climate activists and like radical leftists, it's frustrating how none of them will wear a freaking respirator. The next one is, this question is hard to answer. I can only compare it to my experience with endometriosis. I was still in school when my symptoms became disabling and severe. Whenever I told a teacher that I needed to move a school project or presentation around because it would be at a time where my symptoms would be at the worst, I was met with understanding and respect. It was never an issue to accommodate me. Now with long COVID, where my symptoms are far worse, I am met with no accommodations. I am told that my condition isn't real and that I should simply just push through. I was never treated this way with a classic or recognized condition. Just to add, because I have endometriosis myself, endometriosis is not a well-recognized, funded, and researched condition. It's not like cancer where people have a lot of respect and understanding for it.
Another quote here. This person says, it feels like I've died and the world is going on without me.
The last quote we have is, it makes me feel so othered when 99% of the people who have seen how badly this has affected me don't think it can happen to them and don't do anything to stop themselves from getting COVID.
Yeah, that feeling of being ignored and hated by the general public isn't just emotional, it's practical. Public health protections are gone, research funding is drying up, and people are still getting sick. They're still getting multiple COVID infections. They're still getting disabled, but the world just wants to pretend that this is in the past. And that's why advocacy is so important. So people in our survey were really clear about what needs to change.
Yeah, so 50% said that we need better treatment options. 24% said that we need more awareness campaigns for the general public on the risk and trajectory of long COVID. 21% said we need better research. 17% said we need more provider education around long COVID. And the final 17% said that we need better tools for prevention, such as sterilizing vaccines, and more advocacy around precautions.
Yeah, and just to note, the people selected multiple here.
Yeah.
So one respondent said, advocates should mask up, follow the playbook that was used to counter smoking when doctors were promoting cigarettes. And we actually had to look this up because we aren't old enough. But apparently, yes, it was a thing. Doctors promoted cigarettes and said that they were safe. Our healthcare providers are not always on the front lines of medicine and understanding.
Yeah. Another quote we got was, we need doctors to start communicating to their patients that getting sick every 2 to 3 months is not normal. Amen.
Yeah, because I don't know about you, but I didn't get the flu multiple times a year.
You got it
But people are
once.
getting COVID multiple times a year on top of RSV, flu, norovirus. All of it is just, it's not
Yeah.
normal for bodies to be sick this
No.
often
And it
in
even
this world.
it harms your body to get viral infections so regularly. It harms your immune system. This idea of, oh, I need to get the virus to be healthier afterwards is complete nonsense. So, Jessie, what do people wish more people understood about long COVID?
These responses were so good. The summary is that, COVID is still very much a threat.
Yeah.
Especially as people are piling up on infections. There are over 200 possible symptoms, as we noted, and conditions like POTS, MCAS, and ME/CFS are part of it. And these are really difficult illnesses to deal with.
Yeah.
People aren't making this up, and they're not lazy. One person said they were the fittest they'd ever been before they got sick, and now they would just give anything to go for a run again.
Yeah, absolutely. 100%. I always ask myself when doctors are like, oh, you choose to be sick, like who would choose to be this sick? Who would choose this life for themselves and their loved ones? It really upsets me when people insinuate that I could just push harder and do more. Like long COVID isn't a mental illness or psychosomatic. My inability to do more isn't some mental block that I have to overcome. It's a physical limit that I cannot overstep without having massive consequences. And people deciding to ignore that makes me really upset because it downplays the severity of long COVID and our disability.
Yeah, people were also very clear that they would like to try things. They want to try off-label or experimental therapy. So one person shared, we need medical treatments now, and we're willing to try anything with even a small chance of working. Don't wait until you find something that works 100% for 100% of patients. Let us try something that would give us even a small improvement to our lives. And, even 10% improvement when you are suffering with this many systemic problems, like this many systems going wrong, 10% can be a huge increase in quality of life.
Absolutely. And what bothers me so much is that there is no on-label medication for long COVID. Everything is off-label. We live in off-label land. Even if we take medications for our POTS or for our MCAS or for our ME/CFS, none of these medications were specifically developed to treat these conditions. They were developed for different conditions that are now being used off-label to treat POTS, ME/CFS, MCAS, etc. When doctors are like, oh, it wasn't developed for that. So many medications weren't developed for that. Viagra was not developed for erectile dysfunction. So I think doctors really just have to learn to listen to patients, especially if they ask about specific medications, to at least do the research.
One of the quotes for this question, the question being, what do people wish more people understood about long COVID, is how serious and disabling it is, how damage and dysfunction can take years to reveal itself, that the young, the middle-aged and old, the male, female, and non-binary folks alike are all at risk, that the more infection someone has, the higher their chances of serious illness there is for everyone, even the healthiest of people, which, by the way, I was in the best shape of my life with perfect blood work and zero comorbidities at the time of my one and only infection. That's the quote. But I kind of also feel this because I was also a very active, healthy person and no pre-existing conditions before this destroyed my life. Not to say that that is worse, right? But I think there's that misconception that, oh, it can't happen to me because I run or I eat organic or whatever. Like there are so many athletes, right, that are dealing with this.
What also really bothers me is this kind of politicization of like, oh, it will only affect people with pre-existing conditions, as if people with pre-existing conditions aren't contributing.
Like worth protecting.
Yeah, aren't contributing members to society, aren't worthwhile. Like I have a congenital heart defect, I have endometriosis. Does that mean that my life is not worth as much as Jessie's because she's perfectly healthy? We're deciding, oh, disabled people's lives are not worth protecting, so I'm not going to wear a respirator. Anyways, back to the quotes. Another person shared that it is life paralyzing. And someone else said, every time you get infected, you roll the dice with your own future.
Let's roll the dice or play Russian roulette.
Yeah, exactly.
Pick your analogy. This next quote just rings so true to me. And I've actually been saying this ever since I got sick. And I was so glad someone else said it. They said, you don't get a break. There are no weekends, no holidays, no reprieve. Like lockdowns were hard for people, but being trapped in a body that doesn't work is 20,000 times worse.
Yeah. So, as we already mentioned, today is Long COVID Awareness Day.
However, many respondents weren't aware of any planned protests in their area, and they felt that society just doesn't care enough to organize one. But we do know of a few events that are taking place all over the world today. So if it's still early in the day for you and you're able to, check out the Substack post in our show notes to find a guide to all the events taking place today and the next few days.
Yeah, we are not sure if our list is a comprehensive list. We did try to find out as much as possible, but our list really only covers North America and Europe. So if you can't find one in your area, maybe your local mask block or long COVID group can tell you a little more. And if you have the energy to, maybe you can spontaneously organize your own event in your own town. But if you're listening to this and wondering what you can do if you're unable to participate in a protest, there are a few things you can do to spread awareness without leaving your home.
Yeah, the biggest and lowest effort thing you can do from home is probably posting on social media.
You can also write or call your representatives or local politicians to push for research funding and better healthcare policies and support for long haulers.
And if you're financially able to, you could support long COVID organizations through a donation and encourage others to do so. Even small donations can make a difference. So some organizations that I think are worth supporting are the Patient-Led Research Collaborative, the Long COVID Advocacy Project, Long COVID Justice, Long COVID Kids, the Bateman Horn Center, which is an institute focused on research, clinical care, and medical education around ME/CFS, long COVID, and fibromyalgia. Also, the Open Medicine Foundation. If you'd like to read up on what each of them do before donating, you can find their information in our show notes.
Yeah, and I would like to also mention at this point that you can also donate to local long COVID groups or mask blocks. They do a lot of important work in helping people access things like good quality respirators, HEPA filters, basically everything you need to have clean air. And if you have a box of respirators that you bought that don't fit your face, that don't have a tight seal, you don't know what to do with them, then you can donate those to your local mask block. Many of them are also taking financial aid, so money. Then I think many mask blocks will be very, very thankful about your donation. But please do make sure to respect your energy envelope and your safety. Your health comes first, and if you're unable to do anything today and unable to donate anything, then that is completely okay. We all understand just how disabling long COVID is. And this is why we and most other long COVID organizations welcome allies to join us in this effort. Many with long COVID are just too sick to fight for themselves and need allies to help get their voices heard. So offer to attend Awareness Day events in our place or to post about it on social media today.
Yeah, and truly, we are so grateful for everyone that responded to the survey. So we just want to say thank you to the 106 people who not only took time out of their day to fill out our survey, but gave just the best responses.
Yeah.
And we just felt every one of them. So we really appreciate all of you, and we just really appreciate this community.
Absolutely. And this wraps up today's episode. As a reminder, while our discussions do offer medical-related insights, this is not medical advice. Always consult your healthcare team with any of your medical concerns. For our listeners interested in joining our Discord community, find the link in the description to connect with us. You can find the survey results and other research we quoted in the Substack post linked in the show notes. It might take a while for the survey results to become available as we are a small team of disabled long haulers, but be sure to subscribe to our Substack if you don't want to miss out on it. We also aim to release episodes monthly or every other month, depending on our spoons and capability. So please subscribe and stay tuned for future episodes. Until the next time, this is the COVID Longhaulers Podcast signing off. See you on the next one.